Hello and welcome back, or if you're new here, welcome to the channel where we talk predominantly about topics related to mental health and where I strive to inform you all about various topics related to mental health. So this is a follow-up to my video of symptoms of ADHD part 2. So today I will be talking further about symptoms of ADHD, its causes, diagnosis, and some other information. Now, some more symptoms of ADHD that are related to it are that people with ADHD can have drastic changes in weight, seem unable to relax, or be more lethargic than usual. They talk about feeling guilty or worthless. They feel empty or unable to feel emotions, or otherwise known as being numb. Have thoughts about suicide or self-harming. Suicide is the act or an instance of taking one's own life voluntarily and intentionally. Self-harming is the act of purposely hurting oneself, as by cutting or burning the skin, as an emotional coping mechanism. Although most cutters are young women who have been emotionally, sexually, or physically abused as children. Research shows that this type of particular self-harm also appears in other groups and is not isolated only to this particular demographic. Actually, self-harm, for example, cutting their skin or taking an overdose. Sleep problems, finding it difficult to get to sleep at night and having irregular sleep patterns. Autistic spectrum disorder, this affects social interaction, communication, interests, and behavior. Dyspraxia is a condition that affects physical coordination. Epilepsy is a condition that affects the brain and causes repeated fits or seizures. Tourette's syndrome, this is a condition of the nervous system that is characterized by a combination of involuntary noises and movements, otherwise known as tics. ADHD can cause learning difficulties such as dyslexia. Dyslexia is a specific learning difficulty, which means it causes problems with certain abilities used for learning, such as reading and writing. Signs of dyslexia usually become apparent when a child starts school and begins to focus more on learning how to read and write. A person with dyslexia may read and write very slowly, confuse the order of letters in words, be confused by letters that look similar and write letters the wrong way around, such as letters B and the letter D. A person with dyslexia may have poor or inconsistent spelling, understand information when told verbally, but have difficulty with information that is written down. They may find it hard to carry out a sequence of directions. They could struggle with planning and organization. Although people with dyslexia may struggle in these ways, they often have strong skills in other areas such as creative thinking and problem solving. Causes of ADHD. The exact cause of ADHD is not fully understood, although a combination of factors is thought to be responsible. Genetics play a big part when it comes to ADHD because it tends to run in families. And in most cases, it is thought that the genes you inherit from your parents is of importance because they are a significant factor in developing this condition. Research does show that parents and siblings of someone who has ADHD are more likely to have ADHD themselves. However, the way ADHD is inherited is likely to be complex and is not thought to be related to a single genetic fault. Brain function and structure. Research has identified a number of possible differences in the brains of people with ADHD from those without the condition, although the exact significance of these is not clear. As an example, studies that involve brain scans have been shown to suggest that certain areas of the brain may be smaller in people with ADHD, whereas others may be larger. There have been other studies that suggest people with ADHD may have an imbalance of neurotransmitters in the brain, or that these chemicals may not work properly. Groups at risk. Certain people who are believed to be more at risk of developing ADHD include people who were born prematurely, before the 37th week of pregnancy, or with a low birth weight, or have been diagnosed with epilepsy, or if they have brain damage that either happened in the womb or after a severe head injury that occurred later in life. Diagnosis of ADHD. If you suspect that either you or your child may have ADHD, then you should speak to a GP. You can also speak to your child's teacher or their school special educational needs coordinator, or SENCO for short. While the GP cannot formally diagnose ADHD, but they can discuss your concerns with you and refer you to a specialist for assessment, if necessary. Your school may also be able to arrange a specialist referral for your child. When you see a GP, they may ask you a series of questions which I will dive into and tell you what they are. About your symptoms or those of your child. When these symptoms first started, where these symptoms occur, for example, at home, in school, college, or university, or at work. Whether the symptoms affect you or your child's day-to-day life, for example, if they make socializing difficult, if there have been any recent significant events in you or your child's life, such as a death or divorce in the family, if there's a family history of ADHD, about any other problems or symptoms of different health conditions you or your child may have. The next steps that should be taken will first be talking about refers to children and teens. If the GP thinks your child may have ADHD, they may first suggest a period of watchful waiting, lasting around 10 weeks, to see if your child's symptoms improve, stay the same, or get worse. They may also suggest starting a group-based ADHD-focused parent training or education program. Being offered a parent training and education program doesn't mean you have been a bad parent. It aims to teach you ways of helping yourself and your child. If your child's behavior does not improve, and both you and the GP believe it's affecting their day-to-day life, the GP should refer you and your child to a specialist for a formal assessment. For adults with possible ADHD, the GP will assess your symptoms and may refer you for an assessment if you were not diagnosed with ADHD as a child, but your symptoms began during childhood and have been ongoing since. Your symptoms cannot be explained by a mental health condition. Your symptoms significantly affect your day-to-day life. For example, if you're underachieving at work or find intimate relationships difficult. You may also be referred to a specialist if you had ADHD as a child or a young person, and your symptoms are now causing moderate or severe functional impairment. Assessment. You or your child may be referred to one of the following types of specialists for a formal assessment. This could be a child specialist or adult psychiatrist, a pediatrician, an appropriately qualified healthcare professional with training and expertise in the diagnosis of ADHD. Who you're referred to depends on your age and what's available in your local area. There's no simple test to determine whether you or your child has ADHD, but your specialist can make an accurate diagnosis after detailed assessment. This assessment may include a physical exam, which can help rule out other possible causes for the symptoms, a series of interviews with either you or your child, interviews or reports from other significant people such as partners, parents, and teachers may be requested, diagnosis in children and teens. Diagnosing ADHD in children depends on a set of strict criteria. To be diagnosed with ADHD, your child must have 6 or more symptoms of inattentiveness or 6 or more symptoms of hyperactivity and impulsiveness. To be diagnosed with ADHD, your child must also have been displaying symptoms continually for at least 6 months, started to show symptoms before the age of 12, been showing symptoms in at least 2 different settings, for example, at home and at school, to rule out the possibility that the behavior is just a reaction to certain teachers or to parental control. Symptoms that make their lives considerably more difficult on a social, academic, or occupational level. Symptoms that are not just a part of a developmental disorder or difficult phase, and are not better accounted for by another condition. Diagnosing ADHD in adults is more difficult because there's some disagreement about whether the list of symptoms used to diagnose children and teens also applies to adults. In some cases, an adult may be diagnosed with ADHD if they have 5 or more symptoms of inattentiveness, or 5 or more of hyperactivity and impulsiveness. Listed in the diagnostic criteria for children with ADHD. As part of your assessment, the specialist will ask about your present symptoms. However, under current diagnostic guidelines, a diagnosis of ADHD in adults cannot be confirmed unless your symptoms have been present from childhood. If you find it difficult to remember whether you had problems as a child, your specialist may wish to see your old school records or talk to your parents, teachers, or anyone else who knew you well as a child. For an adult to be diagnosed with ADHD, their symptoms should also have a moderate effect on different areas of their lives, such as underachieving at work or in education, driving dangerously, difficulty making or keeping friends, difficulty in relationships with partners. Treatment for ADHD can help relieve the symptoms and make the condition much less of a problem in day-to-day life. ADHD can be treated by medication or therapy, but a combination of the two is often best. Treatment is usually arranged by a specialist, such as a pediatrician or psychiatrist, although the condition may be monitored by a GP. Medication. There are 5 types of medicine listed for the treatment of ADHD: methylphenidate, lisdexamfetamine, dexamphetamine, atomoxetine, and guanfacine. These meds are not a permanent cure for ADHD, but may help someone with the condition concentrate better, be less impulsive, feel more calm, and learn and practice new skills. Some meds need to be taken every day, but some can be taken just on school days. Treatment breaks are occasionally recommended to assess whether the meds are still needed. If you were not diagnosed with ADHD until adulthood, a GP and a specialist can discuss what meds and therapies are suitable for you. If you or your child is prescribed one of these meds, you'll probably be given a small amount at first, which may then be gradually increased. You or your child will need to see a GP for regular checkups to ensure the treatment is working effectively and check for any side effects or problems. It's important to let the GP know about any side effects and talk to them if you feel you need to stop or change the treatment. Your specialist will discuss how long you should take your treatment, but in many cases, treatment is continued for as long as it is helping. Methylphenidate. It is the most commonly used med for ADHD. It belongs to a group of meds called stimulants, which work by increasing activity in the brain, particularly in areas that play a part in controlling attention and behavior. Methylphenidate may be offered to adults, teens, and children over the age of 5 with ADHD. This med can be taken as either immediate release tablets, small doses taken 2 to 3 times daily, or as a modified release tablet, which is taken once a day in the morning with the dose released throughout the day. Common side effects include a small increase in blood pressure and heart rate, loss of appetite, which can lead to weight loss or poor weight gain, trouble sleeping, headaches, stomach aches, feeling aggressive, irritable, depressed, anxious, or tense. Lisdexamphetamine. Lisdexamphetamine is a med that stimulates certain parts of the brain. It improves concentration, helps focus attention, and reduces impulsive behavior. It may be offered to teens and children over the age of 5 with ADHD if at least 6 weeks of treatment with methylphenidate has not helped. Adults may be offered lisdexamphetamine as the first choice med instead of methylphenidate. Lisdexamphetamine comes in capsule form and is taken once a day. Common side effects of lisdexamphetamine include decreased appetite, which can lead to weight loss or poor weight gain, aggression, drowsiness, dizziness, headaches, diarrhea, and nausea and vomiting. Dexamphetamine. Dexamphetamine is similar to lisdexamphetamine and works in the same way. It may be offered to adults, teens, and children over the age of 5 with ADHD. Dexamphetamine is usually taken as a tablet 2 to 4 times a day, although an oral solution is also available. Common side effects of dexamphetamine include decreased appetite, mood swings, agitation and aggression, dizziness, headaches, diarrhea, and nausea and vomiting. Atomoxetine. Atomoxetine works differently from other ADHD meds. It's a selective noradrenaline reuptake inhibitor, SNRI for short, which means it increases the amount of a chemical in the brain called non-adrenaline. This chemical passes messages between brain cells, and increasing it can aid in concentration and help control impulsiveness. Atomoxetine may be offered to adults, teens, and children over the age of 5, if it's not possible to use methylphenidate or lisdexamphetamine. It's also licensed for use in adults if symptoms of ADHD are confirmed. Atomoxetine comes in capsule form and is usually taken once or twice daily. Common side effects of atomoxetine include a small increase in blood pressure and heart rate, nausea and vomiting, stomach aches, trouble sleeping, dizziness, headaches, and irritability. Atomoxetine has also been linked to some more serious side effects that are important to look out for, including suicidal thoughts and liver damage. If either you or your child begin to feel depressed or suicidal while taking this med, speak to your doctor. Guanfacine. Guanfacine acts on part of the brain to improve attention, and it also reduces blood pressure. It may be offered to teens and children over the age of 5 if it's not possible to use methylphenidate or lisdexamphetamine. Guanfacine is usually taken as a tablet once a day in the morning and evening. Common side effects include tiredness or fatigue, headaches, abdominal pain, dry mouth. Guanfacine is not recommended for treating adults with ADHD without specialist advice. As well as taking meds, different therapies can be useful in treating ADHD in children, teens, and adults. Therapy is also effective in treating additional problems, such as conduct or anxiety disorders that may appear with ADHD. Here are some of the therapies that may be used. Psychoeducation. This means you or your child will be encouraged to discuss ADHD and its effects. It can help children, teens, and adults make sense of being diagnosed with ADHD and can help either you or your child cope and live with the condition. Behavior therapy. Behavior therapy provides support for caretakers of children with ADHD and may involve teachers as well as parents. Behavior therapy usually involves behavior management, which uses a system of rewards to encourage your child to try to control their ADHD. If your child has ADHD, you can identify types of behavior you want to encourage, such as sitting at the table to eat. Your child is then given some sort of small reward for good behavior. For teachers, behavior management involves learning how to plan and structure activities and to praise and encourage children for even very small amounts of progress. Parent training and education programs. If your child has ADHD, specially tailored parent training and education programs can help you learn specific ways of talking to your child and playing and working with them to improve their attention and behavior. You may also be offered parent training before your child's diagnosis of ADHD is confirmed. These programs are usually arranged in groups of around 10 to 12 parents. A program usually consists of 10 to 16 meetings lasting up to 2 hours each. Being offered a parent training and education program does not mean you have been a bad parent. It aims to teach parents and caretakers about behavior management while increasing confidence in your ability to help your child and improve your relationship. Social skills training. This is training that involves your child taking part in role play situations and aims to teach them how to behave in social situations by learning how their behavior affects others. Cognitive behavioral therapy, or CBT, is a talking therapy that can help you manage your problems by changing the way you think and behave. A therapist would try to change how you or your child feels about a situation, which would in turn potentially change their behavior. CBT can be carried out with a therapist individually or in a group. Other possible treatments. There are other ways of treating ADHD that some people with the condition find helpful, such as cutting out certain foods and taking supplements. However, there's no strong evidence these work, and they should not be attempted without medical advice. People with ADHD should eat a healthy and balanced diet. Do not cut out foods before seeking medical advice. Some people may notice a link between types of food and a worsening of symptoms related to ADHD. If this is the case, keep a diary of what you eat and drink and what behavior follows. Discuss this with a GP, who then may refer you to a dietitian. Some studies have suggested that supplements of omega-3 and omega-6 fatty acids may also be beneficial for people with ADHD, although the evidence supporting this is very limited. It's advisable to talk to a GP before using any supplements because some can react unpredictably with meds or make it less effective. You should also remember that some supplements should not be taken long term, as they can reach dangerous levels in your body. If you're the parent of a child with ADHD, be sure your GP or specialist helps you understand the difference between ADHD and any other problems your child may have. Think about who else needs to know about your child's ADHD, such as their school or nursery. Find out the side effects of any meds your child takes and what you need to look out for. Getting to know people at local support groups can stop you feeling isolated and help you to cope. Living with ADHD can be difficult, as the symptoms can make everyday activities more of a challenge. It's important to get the support you need to understand and cope with you or your child's condition. Ways to cope for parents of children with ADHD. Caring for a child with ADHD can be challenging. The impulsive, fearless, and chaotic behaviors typical of ADHD can make everyday activities exhausting and stressful. Although it can be difficult at times, it's important to remember that a child with ADHD cannot help their behavior. People with ADHD can find it difficult to suppress impulsiveness, which means they may not stop to consider a situation or the consequences before they act. If you're looking after a child with ADHD, you may find this advice helpful. Plan the day so your child knows what to expect. Set routines can make a difference to how a child with ADHD copes with everyday life. For example, if your child has to get ready for school, break it down into structured steps so they know exactly what they need to do. Set clear boundaries. Make sure everyone knows what behavior is expected. Set routines can make a difference to how a child with ADHD copes with everyday life. For example, if your child has to get ready for school, break it down into structured steps so they know exactly what they need to do. Set clear boundaries. Make sure everyone knows what behavior is expected and reinforce positive behavior with immediate praise or rewards. Be clear, using enforceable consequences such as taking away a privilege if boundaries are overstepped, and follow these through consistently. Be positive. Give specific praise instead of saying a general "thanks for doing that." You could say "you washed the dishes really well." Thank you. This will make it clear to your child that you're pleased and why. Giving instructions. If you're asking your child to do something, give brief instructions and be specific. Instead of asking, "Can you tidy your bedroom?" say, "Please put your toys in the box and put the books back on the shelf." This makes it clearer what your child needs to do and creates opportunities for praise when they get it right. An incentive scheme. Set up your own incentive scheme using a points system or star chart so good behavior can earn a privilege. For example, behaving well on a shopping trip will earn your child time on the computer or some sort of game. Involve your child in it and allow them to help decide what the privileges will be. These charts need regular changes or they become boring. Targets should be immediate, for example, daily. Intermediate, for example, weekly. And long term, for example, every 3 months. Try to focus on just one or two behaviors at a time. Intervene early. Watch for warning signs if your child looks like they're becoming frustrated, overstimulated, and about to lose self-control. Intervene. Distract your child, if possible, by taking them away from the situation. This may calm them down. Social situations. Keep social situations short and sweet. Invite friends to play, but keep playtime short so your child does not lose self-control. Do not aim to do this when your child is feeling tired or hungry, such as after a day at school. Exercise. Make sure your child gets lots of physical activity during the day. Walking, skipping, and playing sports can help your child wear themselves out and improve their quality of sleep. Make sure they're not doing anything too strenuous or exciting near bedtime. Eating. Keep an eye on what your child eats. If your child is hyperactive after eating certain foods, which may contain additives or caffeine, keep a diary of these and discuss them with the GP. Bedtime. Stick to a routine. Make sure your child goes to bed at the same time each night and gets up at the same time each morning. Avoid overstimulating activities in the hours before bedtime, such as computer games or watching TV. Nighttime. Sleep problems and ADHD can be a vicious cycle. ADHD can lead to sleep problems, which in turn can make symptoms worse. Many children with ADHD will repeatedly get up after being put to bed and have interrupted sleep patterns. Trying a sleep-friendly routine can help your child and make bedtime a less of a battleground. Help at school. Children with ADHD often have problems with their behavior at school, and the condition can negatively affect a child's academic progress. Speak to your child's teachers or their Senko about any extra support your child may need. Adults with ADHD. If you're an adult living with ADHD, you may find the following advice helpful. If you find it hard to stay organized, then make lists, keep diaries, stick up reminders, and set aside some time to plan what you need to do. Let off steam by exercising regularly. Find ways to help you relax, such as listening to music or learning breathing exercises for stress. If you have a job, speak to your employer about your condition and discuss anything they can do to help you work better. If you're at college or university, ask about what adjustments can be made to support you, such as extra time to complete exams and coursework. Talk to your doctor about your ability to drive, as you'll need to tell either the Driver and Vehicle Licensing Agency, or DVLA if you're in the UK, or the Bureau of Motor Vehicles if in the US, if your ADHD affects your driving. Contact or join a local or national support group. These organizations can put you in touch with other people in a similar situation and can be a good source of support, information, and advice. Well, this is the end of this video, and I hope that it has helped somebody who is living with this disorder or knows someone who is. And this will close out my series of videos on ADHD. If you have any suggestions on what I should cover next, or if you have a particular disorder you would like me to do videos on, leave them in the comments section of this video. And if you like what I do here at the channel, like, comment, and subscribe. That way you don't miss out on any new or upcoming content. Until then, this has been Chris, Mental Health Advocate, and I'll catch you on the flip side.